So a lot of the new drugs blocking the adenosine pathway are becoming increasingly recognized as important complements to using PD-1 blockade. So if you have your PD-1 inhibitors, such as Nivolumab, Pembrolizumab in gastric cancer, and now you have a second added way to suppress some of the byproducts of bad parts of the immune system, they can complement each other. So for example, the adenosine axis is regulated by several enzymes. One of those is CD39. So blocking CD39 enzymatically effectively blocks adenosine, which is an immune suppressing molecule. So that's one of the rationales. The other rationale is that you can increase the production of extracellular ATP, which by increasing extracellular ATP, that allows for increased immune activation. So those are the two main mechanism actions by how we think CD39 blockade works.